guys, it's Dr. Brandy for their episode of Pregnancy Pain Sucks. I have one of my most dear people that is in my first book. This is Kat of KatFit. I've known her for, I think, over 10 years, and she's always a trusted resource for me locally with any pregnant patients or postpartum. That's her specialty. So, Kat, if you want to introduce yourself to our audience about yourself and what you do.
Yeah, absolutely. So I'm Kat. I own KatFit, and I work specifically with moms and women who are going through that postpartum, prenatal to postpartum area. And shockingly, I have almost 2 decades of experience in the industry, from starting out training with college athletes all the way now in the latter, it's 13 years, 13 years in training women in postpartum and pregnancy. So
Yeah, I know you're really passionate about it because you have both of us have sort of been driven to our careers by our own kids and also the challenges we've had internally in going through motherhood and pregnancy. And that sort of sealed us both to be very passionate about what we do. Do you want to talk about what got you? I know you're very passionate about your work. You're very, like me, very particular about how it's done and then the philosophy behind it we'll get into a little bit later. But do you want to highlight what got you into doing this and why it's so important that you do this with women to give them
yeah,
back their power?
absolutely. Yeah. So, it goes, I always kind of framework myself as three titles and not exclusively. I'm a coach, I'm an athlete, and a mom. And all three of those titles go into how I work with women and from my experience. So the mom portion, my second pregnancy, out of the blue, was a completely high risk pregnancy. I'll never forget the statement my OBGYN said to me. She's like, "You're one of my healthiest patients, and I don't understand why this is happening." I had a one in, I don't know how many thousands, pregnancy of where I was on bed rest from the time I got that positive pregnancy test to the time he was delivered at, it was like 33 weeks. And so here I was in a healthy body where I have pushed myself to the limits and now resigned to the couch and then on hospital bed rest later in the pregnancy, unable to move my body in the ways I wanted to. And during that time, I was also 6 months into launching my business. So that was very tricky. And it ultimately taught me a deeper meaning on how to coach individuals, most in particular women, and how there was a void of assistance and coaching through this time of prenatal to postpartum, where it was an acceptance of this is your new reality. There was no digging deeper of how to work with the woman behind the title of mom, and also the understanding of what is going on internally and physiologically with a woman to go from being a woman to prenatal to postpartum and what that looks like. And the athlete part comes into is when I would train athletes, I would look at, like, how do I set them up for success? My goal is when athletes came in, their freshman year, or when I was recruiting them, I wanted to elevate them with their goals, and I wanted to see them succeed. So their workouts had to get them there. And that's how I saw it was missing in the fitness industry. It was get your body back, your pounds and inches, your life choices were a punishment to what you did to your body versus, hey, you know what? These are all things to be considered, but they are not limiting factors. And how do we get yourself from point A to point B while honoring the demands of motherhood, who you are, and the athlete you want to be? And when I say athlete, does not mean you have to be competing for a specific athletic formal competition, because life demands an active, healthy body to get yourself through the days, and we want to feel better and stronger, and that's how we want our workouts to measure up for ourselves. So that's why I kind of say I'm like coach, athlete, mom are the things that I blend into it. And this high risk pregnancy taught me how to connect with individuals more so when they are, I'm going to say, out of commission, when there is something out of your control that prevents you, whether it be a high risk pregnancy, illnesses, or even a lot of work demands, and how can we still tune into our health and physical movement in capacities that will allow us to thrive. So and then that at that point, sorry, jumping back, like that's where my business where I was like, I only want to focus on the woman because I can speak uniquely to that and see how to empower them to be more in times of higher output demand.
Yeah, I think that's so powerful because I think what I'm realizing, I mean, I've been in practice for 24 years and up until the point of 2006, so I graduated in 2002, and I planned that second baby because the first one, I really didn't do it right. I was in school and I really wanted to savor at this time and I prepared the practice. And then, kind of like you, at 17 weeks to find out that I couldn't practice anymore or really do anything. I think what I'm seeing is the common theme between my patients, which I've seen you before, is they're very high demanding patients in that they have expectations for themselves. They see themselves in certain roles. So when I wasn't able to do things and had to say, no, I can't do that and advocate for myself and now this baby, it was such a mind screw for me because I'm not used to not being able to do things. And it felt, I want to talk a little bit about, if that's okay to go deep on that, is like physically it was a shit show off the bat. Like and it was it seemed like you, I had gained 80 pounds with the first one. The second one I was not going to do that. So I was in great shape. You know, I got myself ready. I did everything I needed to do. And then I can't practice or do anything that I love. And because I love practicing. So for me, the mental conversation, it was so complicated and deep that it was like, I can't believe this happened. I can't believe I asked for the second pregnancy and now it's going off the rails and now I can't work and pay my mortgage with my kid or feed my other kid and support myself, and just mentally I lost myself. And I wanted you to speak to that a little bit because I know that the pregnancy, I delivered at 34 weeks with preeclampsia, and the whole, it just, I'm getting chills. Like the whole thing, it sounds like I'm a baby, but it was like not fair. Do you know what I'm saying? Like
Oh
I
yeah.
had such beautiful thoughts for this pregnancy, and that's why I think I'm so passionate about what I do, because you only get so many shots of this.
Mhm.
And mine was completely foobarred. Like it was just like not what I expected. And that's why I've written books, and like I just want to give women that back. And I think that's what you and I have in common, that we suffered mentally from that. And I have a kid with special needs now. That pregnancy ended up, the child has special needs, and I've talked before about feeling guilty, you know, that it went off the rails and there was nothing I could do. Can you speak to the head chatter, if you don't mind, of what women might be going through who are in a similar spot and their body is betraying, they think their body's betraying them?
Oh, 1,000%. And what you highlighted right there was it is not fair. And that's a perfectly normal and valid response. And I went through that. And it was, you know, with my first pregnancy, I was like, I'm going to say it's textbook pregnancy. And he was 2 weeks late. We wound up in an unplanned
Yeah.
C-section. And so I was like, all right, game on. We're going to go for VBAC. We've been cleared for VBAC. Like, this is how it's going to go. And, you know, then in comes the blind side of the pregnancy, the high risk pregnancy. And for me, I always say, you know, being an athlete, I always prided myself in being very mentally strong and being able to visualize and see things through and,
Overcome.
yeah, overcome. It's like, you know, you have to deal with the adversity, pick yourself back up, and you're on to the next. And with this, I found I walked out on myself for everyone else because I had a
Oh my God.
two-year-old son
Sorry,
who needed me. Huh?
that's deep. Like that's,
Yeah.
I think that that's the part people don't understand
Mhm.
is you lose yourself so heavily. Talk to
Yeah.
me about that when you said you walked out on yourself, because I got like I almost started crying. Tell me what that, because I know exactly what you're saying. Tell me what that means to you.
Yeah, there was some point, and I can't pinpoint, like, I'm going to say that intersection where I chose to go away from myself versus giving back to myself. But, you know, looking back on it, it was, I had to put on a mask of being not just happy, like, oh, everything's great. It was, I had to put on a mask of showing up to be there for my 2-year-old son, to be there for my husband, and then everybody else. And what it was telling myself the story of it's not that bad. It's okay. Other people have it worse. And it was depriving myself of the space to take up to be like, I am not okay. None of this is fair. None of this is what I wanted. And I just want to be really upset right now and angry for, I want to be angry because I'm a human and I have emotion. And, you know, it's not fair that I can't parent my 2-year-old child the way I want. It's not fair that I can't show up in my business that I just started that I want, that now I'm watching my income decrease. This is not who I am. This is not, my personality.
Identity.
It's,
You lose your
it's
identity, I think.
exactly,
And it feels
exactly.
powerless. Like it feels, I think that you and I, we're not used to feeling powerless. Do you know what I'm saying? We have autonomy, we have agency, we're resourceful, we can overcome. And it's the one situation that you feel utterly helpless for yourself, for your baby, and those around you. And I don't know, it really bothers me to see, like for me, I didn't have a strong partner in that, and to see people getting that where they have husbands cooking for them or kissing their belly or being supportive, like that just added for a big kick in the D to my situation, because it's like I had to be okay for my business. And so I asked if I could just see pregnancy. And then when I was vulnerable, they were vulnerable. I think that I just did a podcast with somebody who specializes with infant loss. Like she's lost, had a lot of miscarriages.
Yeah.
And the thing she was saying is that like when you're vulnerable, instead of bucking up and saying, I'm fine, don't worry about me, I've got this, you don't have it because it's all new to you. And it's compounded by so much guilt of having another baby, ruining your older one's experience. It was idyllic because you could control it, right? And then all of this other collateral damage. You just lose yourself completely with that. So,
Yeah. And then the second part to that is why I become so passionate about the physical aspect is not only there's that mind piece, but then there's a physical. And for me, I remember once I was I was still in the midst of the storm. At that point, I had been officially diagnosed with postpartum PTSD. This was, gosh, like 3.5 months after my son had arrived, and I got the clearance, and I felt somewhat okay, shaky to start moving my body again. And I'll never forget this one run I went out on where I tripped, found myself on hands and knees and cuts on my knees, and just sitting there being like a complete stranger in my body.
mhm.
This body that I could call upon to do whatever. Like this body that I revered as being so strong. This body after my first pregnancy was like, all right, we're fired up. We're going to like build strength. We're going to go. We're going to do this. We're still invincible. It was gone. And I remember trying to stand up from like how the fall, and just feeling like that baby learning to try and take its first steps again. So shaky and not trusting my body and scared to move my body because I, you know, to your point, it was like, we're moms and I couldn't protect my unborn child. I couldn't stop. There were so
No,
many
it's so
unknowns.
real.
Yeah.
It's still real. But
Yeah.
talk to me, if you don't mind,
Mhm.
about
Yeah.
when you use the term postpartum PTSD,
Yeah.
what did that look like? Or what if somebody's in that right now where they had a baby and they don't feel good, they don't feel right? What did you feel like in your own body, physically and mentally, that somebody might say, maybe that's what I'm going through because I just can't put my finger. Could you put your finger on it of how you felt of like, I'm profoundly depressed? Because for me, when I was depressed when I was pregnant, my psychology professor was the one who said, you need to get checked out. Like, I really think you're depressed. And people like us would just keep going. You think that you're hiding it and masking it from it. What does that look like for a woman that might have this? Or what are the signs that you had that you knew there was a problem?
I actually didn't know there was a problem.
And that's what I'm
Um,
saying. I think that
yeah,
people don't think they have a problem.
yeah.
Yeah.
So going through it, like looking back, I can see it, but going through it, it started, I'm gonna say like the beginnings of it started during the pregnancy. I didn't really see that there. And the full blown, I'm gonna say like that PTSD symptoms didn't start until I was released from the hospital and my son was still in the NICU, where I was like stuck in that fight or flight. I would have this recurring nightmare that I'd wake up in sweats where I was trapped in the OR and I couldn't get out. And every time I would go into the hospital, like to see my son, it was hard for me almost to walk through the NICU doors.
What did you feel in your body? Like a lot of tension or
Oh,
anxiety or like, sorry to take you back to that, but it's like, you
right.
probably still feel it. Like, it's
Oh
just
yeah.
like,
Like
yeah,
talk
I
about it.
know,
I'm like,
I feel it too, because my kid was in the NICU as well. Like, what do you,
yeah.
it's like you want to see your baby, but you
Mhm.
start like feeling like anxious and agitated a little bit. Not so much like just like on edge.
On
And
edge.
with staccato kind of talk. Do you know what I'm saying? Like their talk is even different. And I see this a lot in practice where somebody may not know when they come back for their check with me and I know they're in trouble. Like I can spot. So what's helpful for you? I know what I do with, because I'm not a psychologist. What was helpful for you, or what would you suggest if somebody sees this? Because you want to say, hey, you're losing your mind or you're
Mhm.
crazy, or like you don't want to do that. What's supportive of a friend or a partner to say to you? What did they say, or what was helpful for you that someone said that said, hey, I really think you need some help? Or was it you who did that?
It was actually my husband. He noticed it was so my son was born in the beginning of June, and this was middle of August, so it had been some time, and it was patterns I didn't even know I was doing, and he stood up. I remember I walked into his office. He worked from home at that point, and I walked into his office and I, in his terms, he was like, you just kept repeating like the same story over and over, not like on repeat 24/7,
Yeah, like ruminating.
ruminating. And he stood up from his desk and put his hands on my shoulders and was like, Kat, I can't solve this for you.
Oh,
I don't know how to help you. And he did say, he's
that's,
like, you need help. Like,
oh,
yeah. And I
that's
was
so
like,
sweet. Yeah.
it like kind of, I don't want to say snap me out of it, but I was like, what? Like,
You think you're hiding it from everybody else. Like you're
yeah,
not intentionally hiding it, but you think
no.
you're just doing, you're doing it. So yeah, it's great that he did that, because I think I wrote that partner book about how partners can help. And I think a lot of times you take it like some partners that are not a right fit take it personally, or say like, why aren't you the same before you? Like, do you see this in practice with your clients sometimes, where like you don't have to give up their name, but like where their partner's not helpful, or they're coming because their partner wants them to snap back to what they were before, they're physically or mentally, which is hard to watch because it sounds like you had a good partner. Yeah,
It is
so
so
hard.
hard
The
to
woman
watch.
has no value in her mind. Like I just
Yeah.
posted something yesterday. Is like it's not a caring. It's like, why can't you just be like you were? And through birth, I think every pregnancy you have, you're different. Through life experiences, you're different, and you have to have some grace with that.
Yeah. Yeah.
Speaking of grace, the reason I have you on my podcast is I made a post because part of the studies that I'm doing, like I'm very passionate about movement during pregnancy, because we have one of the most highest maternal and infant mortality rates in the world, and it's not concomitant to the level of technology that we have. And one of the theories that I have that I would love for somebody to study, and I'm not really big into research, is I think our society is so sedentary, and because there's so much fear with pregnancy of doing the wrong thing or hurting your baby, that when women go to their OB and are told, hey, what do you expect? You're pregnant, or just wait till the end of your season, which we don't do to athletes. We would never tell Jalen Hurts, wait till the end of your season, or what do you expect? You're like, it's so ass backwards. my premise is because women don't move, their body is not ready to accommodate for birth. Like your body is not a machine. It needs to move. The body during birth moves in a certain patterns, and if your pelvis and your hips are too tight, you can't accommodate for that. And so then there's worse outcomes, like a healthy mom that moves. And when I made that post, I offended some people unintentionally. So I had to qualify and say, I'm talking about like an uncomplicated birth, right? And we've talked about before we got on this call that every pregnancy is different and you need to check with your OBGYN and make sure that they're in charge of your care. Midwife, OBGYN, they're the medical component that you need to check with. But some people were like, I was on bed rest, or I had placenta previa, or like, and both of us, I want to publicly say, both of us had that situation. So there's no judgment from us. But I wanted to bring you on, and I do advise patients on this, but I'm not the top expert on this. I can do like how to fix it or how to be safe. But you're in the field and been doing this, like you said, for so long. Can you speak to sort of like what you can do, not even like physically as punishment, but to keep your body moving, to keep your mind moving so that you can be sane? Because a lot of people, if you don't exercise, you're not yourself. I only exercise now for core strength, like because I have that extruded disc, and my mental health. Because if I don't exercise, you just feel like blah, like you're not sharp. Do you know what I'm saying? And for me, it's an antidepressant. Can you speak to the women? They weren't mad, but they were sort of like, "What about me?" And I felt horrible. I was like, "Oh my God, I've been that woman. What can you do? If you have a high risk pregnancy after you check with your OBGYN, what are some helpful things that you recommend as a professional in this field with so much experience?"
Yeah, it is so true. And I will say this, one of the things with any pregnancy is in working out, whether you have no restrictions or all the restrictions, is pregnancy isn't a time to go set PRs or um, all the above, do all the intense workouts. And when you have risks and challenges in pregnancies that prevent you from, engaging in just your daily life. One of the things, as it's cleared with your OBGYN, and I'll take my case where it seemed like every week there was more complications popping up with the pregnancy, and I felt like I was being put in more restrictions until he was born. And so there are things that you can do along the way. One of the things I will say that is the best thing, and I try and help this with all my clients with no matter the level of their pregnancy, is work with your mentality. Adopt the phrase, just because I can doesn't mean I should. Mm-hmm. You are not weak during this time. I argue women are
So strong.
so strong. Yeah. You are not losing anything, and there's no makeup in this time period. As much as we want to control every aspect, pregnancy is an uncontrollable, I'm going to say, thing.
It teaches you about letting go. It really does. Like
Yeah,
you're not in control. Yeah.
exactly.
It's just scary as hell for people like us.
Oh, it so is. I'm like, I always said I'm not a control freak, and then
You
pregnancy,
realize you
I'll show
are.
you. But so what I say is, like, we all movement counts,
Mhm.
which can be tough because that's not how the fitness industry or how we've been taught to view our fitness.
For Instagram influencers.
Mm-hmm.
Yeah.
And I'm like, mentally, this is a great time, to your point, with all the Instagram influencers, to turn off those,
Mhm.
to unfollow, create spaces that support you to set you up for success.
Mhm.
Find ways that it's going to have a positive impact on your mental outlook, especially when you want to just zone out for scroll somewhere, when you are in different areas, like that it is reinforcing where you're at. And it's okay. Like I tell my clients, I'm like, if I'm not helping you on social media, which I hope my
Yeah.
message is, unfollow me,
Yeah.
or it's, you need to protect yourself first. With movement, one of the things I talk about is breath is so empowering. when you're going through pregnancy and postpartum, that finding your diaphragm and focusing on your core and getting, you can be seated, that you find a good sit position where you're not rocked back on your sit bones or totally rocked forward where you have a big curve in your lumbar spine, but you have a good straight. I would say like a good cue is breastbone to pubic bone, and just focus on breath. Put your hand on your chest, on your ribs, and feel the air coming into your diaphragm and exhaling from pelvic floor up, feeling the core muscles contract. And I would say like giving the baby a hug,
Mhm.
and even intertwine, it doesn't have to be something formal, but just a little bit of gratitude of like, it's okay, we're here. Like one thing I used to say to my son when I was pregnant with him is like, it was kind of my routine after every appointment. All my appointments were at the hospital. I'd sit in the parking garage and I'd make sure I'd park at this one point because there was a golf course and it was like green space looking out. And I'd sit there and I'd be like, put my hands on my diaphragm and just breathe in and not really hold it, but just, and then exhale, feel the contraction and be like, it's you and me. We got this every day. You and
Present
me.
with
We
the
got
baby.
this.
Yeah, I think that's
Yeah.
the big thing too, is enjoying, even though you can't enjoy pregnancy the way you imagined in your head,
Hmm.
being active or being out in public or doing all the things, the yoga classes, you still can bond with the baby and be grateful and present at the moment. Like send you guys are in it together and you're doing your best. I think that's the other thing is I'm doing my best to keep you safe, and to keep yourself safe. We've talked about that too of not doing, I ended up working, which I shouldn't have, but I needed to pay the bills.
Hmm.
And it's just really, really hard. So if somebody's in the mainland area, you service the mainland area outside of Pennsylvania, what's a good thing for you to recognize a good trainer? Like what can somebody do if somebody's like, hey, I'm a high risk pregnancy, I want to do what I can. Where would they find somebody like you that's very respectful of the OBGYN with, making sure that it's safe and the training? Because that's my biggest problem right now with Instagram, with people giving, not just Instagram, Facebook, TikTok, where I joke that I have sweatshirts that are older than some of the influencers that are on there, like I have the experience. I don't mean to be derogatory, but you can get a fitness trainer certification in a weekend, and that may not mean anything, or they don't even have any training, which is frightening. And that's why I'm so passionate about teaching chiropractors to do it right. Like pregnancy is not a delicate flower time, but at the same time, you need to know all the ins and outs. So talk to me about your certifications and like what somebody would look for if they're looking for somebody to be safe, during their pregnancy, because it's so important.
Yeah. So one of the biggest things I would say is make sure they have a nationally to internationally recognized personal training certification that is, excuse me, that is valid off, off the bat. Because the bigger national ones, like I have in the past, I've had two, but there's um, one was NSCA, CSCS, which that was when I was more in college coaching, and I let that one expire, to be honest, because I was like, it is very rigorous and it's amazing and I loved it. And then I got a second one, which is NASM, which is also very recognized and certified personal training exam, which I hold, and I have to get CEUs every 2 years to uphold that accreditation there.
Mhm.
On top of that, I've layered um, postpartum corrective exercise, pre and postnatal certifications, pelvic floor and core in the postpartum prenatal. And those certifications are all through internationally known physical therapists. I'm not a physical therapist, I make that abundantly clear. But looking at someone's accreditation, do they actually have a pre postpartum? Who is it by? Are they don't be afraid to ask, like, when was the last time you had a continuing education unit on this? What is your experience in here? How would you handle if I couldn't work out, or if I needed to change my workouts? Because not all trainers are created equal, and I'm not the trainer for every person, even if they're pregnant or not. So asking more questions, making sure you feel comfortable that this person, one, knows their stuff, knows how to modify, and isn't going to just hand you a plan and say, well, that's the plan, just do it. Because that's not going to work for most individuals, pregnant or not.
Right.
Um, and you know, the other thing I always say, I do have trainers who are males and train women as well, but I'm a big believer. Have they gone through pregnancy? Do they understand mom life and postpartum? And I will say this, I have a running coach who is not a mom, who writes my workouts and is amazing and understands it. So, I do say that loosely, but like oftentimes a woman who's gone through a pregnancy and understanding their pregnancies is going to be a little bit better to walk somewhat in your shoes or parallel with you in that walk. But yeah, really take a deep dive in their certifications. If it's not listed on their website, ask them, hey, what are your certifications? What do you have? If they get defensive about it, that's probably not a good sign that they would be a good match.
Defensiveness is, yeah, I think
Yeah.
the same as in chiropractic is my big thing and why I've been teaching nationally, just because I think people think it's the same thing. And I'm watching videos where they're adjusting women the same way you would adjust. And like you said, every pregnancy is different. So checking in with them because they're evolving and changing is really important. I think certification and having certification and not dabbling, like I wouldn't go to a trainer who dabbles in pregnancy. That's why I refer to you. It's like there's certain situations you shouldn't just go to somebody that's like, oh, I do pregnancy, and it's like, no, do you do it? Like, do you live it? Do you breathe it? Is that your thing? And I think for both of us, again, that's why I was so like, oh my God, with offending people on TikTok, I was just like, I totally did not mean to do that. What I meant is that people need to move as much as possible, and you need to be ready because the birth is going to happen whether, the baby's coming out. So just
Yeah.
getting yourself ready. And so that's why I wanted to bring, again, I think that shows, and I've noticed that you've done that as well, is like you defer to somebody. I would want the best care for that patient. Like selflessly, I could sit here and say, oh, I'm an expert. Yes, I know what I'm doing, but I want the top person. You are the top person I would go to ask you. I went directly to you. I was like, Kat, help me out because I just want to make sure what I'm saying is sound. And I think not having an ego about that and making sure there's other perspectives about, because I think ultimately, and both of us believe that it's a woman's journey.
Mhm.
It's not our pregnancy. We had our pregnancies. We can only offer resources, and that's what I love to do, is bring a village around the woman to say, because she may resonate with you, she may resonate with me, but and then make her own choice. I think that's the biggest thing with parenting and being pregnant, is understanding that it's your choice and it should be your autonomy, and neither of us are going to force you to do literally anything. Go see somebody, see us, say we're better. Like, it's just not going to happen. So last thing I wanted to cover before, and we forgot to cover it, is talk to me really quickly, if you're okay for time.
Yeah.
Talk to me about women, and I did this, where you get pregnant and you're like, I'm going to start a whole new health journey. I'm going to like get fit and I'm going to go start going to the gym. For me, my advice is, if you were doing it before, continue to do it and monitor. But what do you see? What is your vantage point with that situation? I mean, it's almost like New Year's Eve, where it's like, New Year's Day of resolutions. Talk to me about that, of what women can do now if they're thinking about getting pregnant, or like how much preparation do you advocate, Kat, with your clients? Especially VBACs as well. VBACs is a great situation. That there's a lot you can do.
Yeah. So I've had a number of clients come in, they're like, I want to start a workout program and I'm pregnant. I'm like, okay. So
And they don't work out at all. Like that's the thing, is
yeah.
that, and that's so admirable, because I think you think outside yourself. Like you now you have a baby to worry about. You want to be the healthiest version of
Mhm.
yourself.
Yeah. So what I tell them, I'm like, again, like I said before, just because you can doesn't mean you should. And I start them off. The special consideration is the pregnancy. I want to know how they're feeling. I want to know how their joints are. Are they feeling achy? Are they feeling the energy levels, all the different things? And they can enter a strength training program. and a cardio program, whether that's walking, cycling, running, etc. And I urged them, I said, now's the time to really tune into your body, go inward with it. And I said, I want to know if your pinky toe hurt in a workout, like, because that is going to help me better program and modify for you, because modifications are not signs of weakness. It's meeting the body where it's at. And so I talked to them about skills is understanding in the industry there's the rate of perceived exertion. So oftentimes it gets touted of like you have to lift heavy, and if you're not lifting at a level 9, are you doing anything? And it's like, well, in theory, yes, we want to lift heavy, but heavy is relative to the individual.
Right.
And so when we're in the context of pregnancy, it's really evaluating how we are on that day, and understanding that as long as we're showing up and we're doing the movements properly, we're going to get back to our body. And this aligns with that postpartum of where you are going to have this rugged flexibility with yourself to be adaptable every day, because that baby does not sleep for a long time. Kids require work for a very, very, very long time. I mean, my kids are now 11 and 14, and I always tell my clients, I'm like, I have interrupted workouts still. I'm like, my husband is there and very supportive, but I'm still the default parent. They're going to come to me 9 times out of 10 before they'll go to their dad. So it's looking at, let's understand where we're at, what we can do, and start celebrating sets and reps left on the table. Let's start celebrating unfinished workouts, because those are a victory, and that's going to keep you in the long game. As far as workout design, it really comes down to the individual. It's looking at their biomechanics. I want to make sure that they can move their body. Where are they compensating? Because as the pregnancy progresses, your center of mass is going to extend out. That is going to change how you're going to move in your body. Most often the clients that I work with, we are sedentary. We are sitting at desk-bound jobs and not moving as much. So how can we incorporate movement in their daily life that is going to feel more natural? At first, it might feel more forced, and that is going to carry over to when they have the baby. And then there are certain moves, and the way that we put the weight on the body is going to mimic carrying a bucket seat, picking up the baby, diaper changing. And so it is having them tune into, especially when they're working specifically with me, if there are other children already, because in real time, you don't have the time to be like, let me check my posture. And at 2 a.m. in the morning, when you're exhausted, you're not going to be like, yes, let me make sure my core is aligned while I'm picking up my baby. Yeah. You're going to be like, I'm exhausted, go to sleep. I want sleep. So it's like, if I can get them when they're working out to focus more on the form, yes, we want the weight to be there to put that resistance on the body, but we need to have foundation and structure before we add additional stress. Because if we add more stress meaning higher weights, and the structure isn't sound, it's going to fall down in the terms of soft tissue injuries, musculoskeletal injuries, and then you're going to be out of commission and develop the story of, well, every time I work out, I get injured, which I hear a lot from women. Every time I work out, I get injured. And I'm like, and they're like, well, or my lower back hurts. I just have a bad lower back. And I'm like, well, not necessarily. There's something structurally happening that we need to address. So, and I always stress to them, I said, what the research shows to us is, yes, working out can have an easier delivery and does result in more of a vaginal birth than a C-section. However, it's not the end all be all. Does not mean research doesn't prove anything. What it means is this is going to increase your chances of having the outcome. However, on the other side of birth, you are going to feel much better than you would if you had not done any sort of movement or strengthening through that. The other thing is that I give them is reframing workouts. Yes, they don't get the clearance until 6 to 8 weeks, but there are things that I want them to do as far as breathing and posture and mobility that is giving back to them in that crucial time in the beginning. And I always stress, I'm like, if you do nothing but just care for yourself and the baby, that is amazing. That's all we want. And even if it is 2 years postpartum before you're like, I can actually think about myself again, amazing. There's no lost time.
Yeah, I do a program called Bloom Gives Back where I treat people for free that can't maybe afford care in exchange for them sharing their story and watching their journey unfold because I want to be transparent about chiropractic care and demystify it and elevate it. And I had somebody come back after their C-section and I said, what instructions do they give you of what you can do after the 6 weeks? And they're like, nothing. So I keep seeing all these women with this, with upper back pain, rib pain from doing this with a bucket seat. So they have to lift their kids, even a C-section, they have to lift their kids. They have to, like, you're not a parent. Like, when I teach chiropractors, I was like, stop telling people to stop picking up their kids because you're not a mom. Sit down on the couch or stuff you can modify, but like, it's unreasonable. So our clients, you're my clients, are still having to do stuff getting hurt. So why not give them solid advice, of a baseline, kind of like what you're saying. There's stuff you always can do that'll build the foundation so that when you're ready, psychologically, schedule wise, or physically, at least you're doing something for yourself. Yeah, and pulling that, what advice would you give yourself now to close? What advice would you give yourself knowing what you do now and from what you see? I know you care so deeply about your clients. You're turning all red like I do.
Yeah, I'm like, oh,
Because
oh
both of us
yeah.
care so deeply about what we do, and both of us have had complicated journeys as moms. I know both of us have like really. That's what fuels us, and we see it with our
Yeah.
client. We're empathetic with our client. What advice would you give?
Ooh. I would seriously, and it's so funny because you bring this up because I've been reflecting on this a lot. I don't know why, because it's so cold, and I'm like, it's so cold. Let me distract myself with something else. But I would say, really, if I could go back, and especially, I'm going to say back to the time on that sidewalk where I was like picking myself up and like just feeling this complete mistrust. And I would say celebrate every darn time you show up for yourself, even if it is so much just so you think about wanting to work out. Celebrate that because every little action is such a powerful action to get yourself to where you want to go. And in today's society, it is so quick and easy to flip on your social media and guilt and shame yourself. So the more you can build yourself up, it's going to help do that. Because if I did that, it would save myself so much time of the guilt and shame I layered on myself that was unnecessary. So just celebrate every action because no action is too small to get you to where you want to go.
Same girl, same. I can totally resonate with that because, like, we don't, women, I just think women are so beautiful for what they do and what we go through. And it pisses me off, frankly, of how they're treated. And um, they're not celebrated for doing something like so beautifully hard that if it was easy, everybody would do it. Like, it's just really hard. If you're doing it
Yeah.
right, it's really hard. And I just think we're so hard on ourselves and the way we're spoken to and the expectations that are put on us. It's not supportive at all. And both of us, I think, are I've really loved your social media because I think you have such a balanced approach where you're so real about like you're saying, if you haven't gone through it as a mom or given birth or had a difficult pregnancy, you don't get it. You know what I'm saying? And I think get it, you can get it, but then you can really get it. And then you can turn your life into a beautiful thing where you make other people's pregnancies and having kids and having the baby at home and feeling yourself help reconnecting that we wished we had.
Yeah.
So I really appreciate you being on my. I'm sorry it took so long. I told her it was 10 minutes, and we could talk all day. But
Yeah.
I so admire your work, and I thank you for helping my patients, and I hope it helps your clients with understanding that you're okay, you're doing your best, and we're here for you in any way that we can. So this is Dr. Brandy with another episode of Pregnancy Pain Sucks. Kat is an amazing resource locally. If your pregnancy pain is sucking, she can help you get a stronger core, and then afterwards be a strong mom, to be able to be there for yourself and for your kids. Thank you so much, Kat, for being here today.
You're welcome. Thanks for having
Thanks.
me.